Tell me when you're ready.
Okay.
Good? Okay. All right. So, COVID kind of put the kibosh on our spinal workshops. So for about 20 years or more, we did, as part of our Mineo Family Chiropractic, spinal workshops every week. And every week we did a different topic. We had lots of fun, we made it short, we attracted lots of people, and we had active members here and guests alike. So we feel good about starting that process up again now that all of that is behind us. So our intention is to do spinal workshops twice a month to begin, okay? Different topic every time we do it. So tonight's spinal workshop is called The Laws of Health and Healing. And that's a wonderful beginning point to understand natural health and chiropractic. And my wish for you tonight is that we inspire you and educate you a bit on natural health and wellness, also understand how the body truly works, and not to only believe what we're being told. Right? We're being programmed by with a lot of wrong information from TV and the news and radio and advertisements, and we're constantly bombarded with a philosophy that is counterproductive to health, right? And I want you to understand what the truth is. So that's what our process is going to be like for the future here. So in this office, we educate in terms of laws and principles. We want to leave our opinions out, right? Everybody has opinions. You know what they say about opinions, right? I'm not going to repeat it here, but you know the old saying, right? So we're not going to talk in terms of opinions. Everybody's got one. We want to educate in terms of laws and principles of the universe, okay? So laws are irrefutable. We live in this universe of ours, and we're mammals or organisms within the universe, right? We have to abide by its rules. Angie, I'll invite you to also partake in this, and you can come on out. Okay.
Mm-hmm.
Okay. So, universal laws. We are creatures within this universe. We are under the powers and the forces of this universe. So, where does earthquakes, how do earthquakes happen? Where does that come from? The ocean, the magnificence of the ocean, the ebbs and flows of the tide. There's correlations between these phenomenon in the universe and in our world and in our body, right? So the ebbs and flows of the tides, right? Any boaters here? Any people who like the ocean, right? The expansion, contraction of the body, right? Our cardiovascular system, expansion, contraction. Our breath, expansion, contraction. Isn't that interesting? It's very similar to the ebbs and flows of the ocean, right? So those are some examples of universal laws, right? Gravity, a universal law. It's not the theory of gravity, right? It's the law of gravity. So chiropractic has adopted laws and principles of life. So principles are irrefutable. There is a very powerful principle that chiropractic has adopted called universal intelligence. universal intelligence is what controls this, us and this universe. And in the human organism, there's something called innate intelligence. So innate intelligence is that power, that something special that we possess, and at the very moment when the egg and the sperm connect and unite, at that very moment, we possess, that little blob of jelly, as I call it, possesses innate intelligence. It's a gift that's given to us by a power that's more powerful than me or you. So whatever you believe gives you life or gave you life, that's called innate intelligence. So the irrefutable truth is that human beings have this presence called life. So life is not really visible, it's not quantifiable, we can't really measure it, but we know we either have it or we don't, right? We all possess life here. The difference between us and the cadaver across the street at the funeral home is that presence of life. It's not the body parts that make us healthy. You hear of perfectly functioning Olympic athletes dropping dead at age 21, right? You hear of, come on in, take a seat.
So sorry.
You hear of athletes, right? College athletes on the basketball court just falling over and dying of cardiac arrest, right? We hear that all the time, right? So it's not the body parts that make us healthy. Because that Olympic athlete who had a seemingly perfectly functioning body, you hear those stories of it, that they expire, right? It's the life force, that innate intelligence, that's where health comes from. So that little blob of jelly, when the egg and the sperm unite, has every single roadmap, every piece of information, every direction or instruction that it ever needs to develop into us. How in the world does that happen? How does that little blob of jelly have everything it needs to turn into this little creature in 12 weeks? This is an example of a life-size fetus at 12 weeks. Isn't that amazing?
Yes.
I cannot make that happen. Can you?
Well, half of it.
You just help the process. But we don't physically create this, right? Something of a higher power allows that to happen, right? So that's called innate intelligence. I'm here to tell you that that is the only perfect part of the human organism. Everything else is physical. But the innate intelligence is not physical. It's something other than physical. It's given to us as a gift at that moment of conception. That innate intelligence, which is also known as inborn wisdom. Innate is inborn, intelligence is wisdom. So that innate wisdom, or that inborn wisdom, is what exactly does the healing in our body. It's the only perfect part of our body. So here's how it works. That innate intelligence we possess, somehow the physical brain, part of the nerve system, somehow organizes that innate intelligence. It organizes it and turns it into neurological or electrical messages of sorts. And then it directs those messages through the nerve system, the central nerve system, which is the brain, and the spinal cord that is housed within the spine. And then spinal nerves emanate from that spinal cord and go to every part of the body. Every single cell, tissue, and organ, trillions and trillions and trillions of cells make up tissues. And those tissues make up organs. And groups of those organs make up systems. And those systems make up us. But somehow, innately, there's an inborn wisdom that organizes all that stuff without us even having to think about it. That's another amazing part of the human organism. We don't have to think about it. That's called innate intelligence. What you had last for a meal is now turning into a liver cell or a heart cell or a kidney cell. Are we thinking about that? No. Isn't that that's beautiful? Could you imagine if we had to actively use our educated intelligence to make those things happen? We wouldn't get anything done. It'd be impossible, right? Raise your hand, please. Raise your hand. Put it down. How did that happen? Right? Just that simple command took many different reactions and functions just for you to be able to do that. And we can do it like that. So I'm here to tell you, don't take your bodies for granted. That innate intelligence is perfect. It does not need any help. It just needs to be uninterfered with. The body already knows how to function. It's been taking care of you your whole life. Here's another example. Everyone in this room, this has happened to. You cut yourself. You do nothing about it, right? You just kind of wash it off. And 3 days later, what's there?
Scab.
A scab. There's a simple proof that your innate intelligence is healing you and that you are a self-healing organism. That's one simple example. I have 100 examples like that. So every day of your lives, of our lives, our bodies are functioning automatically and they're healing us without us even knowing it, with very little to no intervention at any time, because it's already programmed that way. That's where health and healing comes from. Healing happens from above down, inside out. It doesn't happen from below up, outside in. So I'm here to tell you that healing does not happen from a pill or a potion or a procedure or a surgery. Are those things sometimes necessary? Yes. Are they sometimes chosen? Sure. That's a personal choice. But does your body need help every second of the day? Absolutely not. Our bodies are a self-healing entity. And we need to understand that, because that'll help us make different choices, more constructive choices in our day-to-day life, right? So those are some examples of innate intelligence. What is health? What is true health? What is optimal health? So if you look in one of the medical dictionaries, you'll see that the definition of health is the state of being. I like doing that. The state of being of optimal physical, mental and emotional, and social well-being, and not just the absence of disease or infirmary. That's important, right? So Let's say that again. It's the state of being of optimal physical, mental and emotional, and they say social. Another word for that is spiritual well-being, right? And not just the absence of disease or infirmity. So what that means is, if we don't have symptoms, it doesn't mean we're healthy. And if we do have symptoms, it doesn't always mean that we're sick, right? That's the not only the absence of disease or infirmity part, right? So symptoms could be warning signs sometimes, and other times we can be perfectly healthy. Here's an example of a symptom that's good, not bad, right? What do most people do when they experience a symptom? Right away we run to the what? Or medicine cabinet, right?
The internet.
Right? Most people grew up in the medical medicine cabinet, right? Right? Every day we're bombarded with billions and trillions of dollars of advertisements. You know, this is one of the few countries, the US, that allows direct marketing of drugs to people by TV and you know, marketing and radio, and you know, many countries don't allow that direct marketing, right? We're bombarded every day. Can we fight against? Can we compete against trillions of dollars of marketing, right? Every day bombarding you. That's why we don't have magazines here with drug ads in it, right? Because there's a better way for natural health, right? So here's a symptom that's good for you, right? It's just an example, right? So if you drink a bunch of vodka, if you drink a bottle of vodka, right? Some people do, right? If you choose to drink a bottle of vodka, what's going to happen generally after that? What may happen a couple hours after that?
It's a headache.
Yeah, we may vomit, right?
Yeah.
Now when people vomit, most of the time, what do? They try to stop that, right?
Yeah.
But in this case, vomiting does what to that alcohol? Gets rid of it, right?
Yeah.
We drank a bunch of poison.
Yes.
The body knows it's not okay. Let me get rid of that. And the result is a vomit. That's good, right? So vomiting is good, right? If we eat some bad food, right? Or we have some other type of toxin in our body, right? And whether it be a germ, a virus, or a bacteria, or a protozoa, and it goes out the other end, right? We have diarrhea, right? Most people do what when they have diarrhea? They take stuff to stop it, right? But do you want to keep that stuff in you? No, you want to get rid of that, right? Your body knows that already. Right? That's why it happens. So those are examples of everyday body functions that are symptoms that people try to stop with outside-in principles, right? Medications, over the counter, this or that. Where if we just trust the body's innate intelligence and let it go, the body is more intelligent than our educated intelligence. Okay? So that's what the definition of health is. Nowhere in there was there any discussion of medications or surgeries or potions or pills, right? Right? So health is the state of being, and it's not only physical, right? The human organism is not only a physical entity, right? The state of being of optimal physical, mental and emotional, and social or spiritual well-being, and not just the absence of disease or infirmity. Right? Think about that definition. That is the definition of health. Okay? So what is chiropractic? Okay? Chiropractic is a philosophy, a science, and an art of all things natural. The very word chiropractic means done by hand. In 1895, D.D. Palmer, who was originally from Canada, lived in Davenport, Iowa, with his family, discovered chiropractic. I have to tell you that story some other workshop. That deserves a whole nother workshop. And on September 18th, we're going to celebrate chiropractic's birthday. But in 1895, chiropractic was discovered. It wasn't created like a medication is created by man. Chiropractic was discovered, which I'll tell you about that amazing story and the very first chiropractic patient later, some other time. But chiropractic is a philosophy of all things natural, an art of the actual physical laying on of hands, which has been therapeutic for eons, right? Thousands of years. People have laid on, we have proof of people laying on hands to heal other human beings, right? And the science is ever evolving. And we're proud in this office to do chiropractic biophysics. That's what the science is called. And chiropractic biophysics is the most peer-reviewed in scientific journals that are mostly medical journals, very prestigious journals, peer-reviewed research of any chiropractic technique or way of doing chiropractic on the planet. And that's what we chose to deliver to you, and we use that as our science. So chiropractic is a philosophy, a science, and an art, which is unique. It's the only true healthcare in the world that are labeled as doctors. Okay? So the only doctors in the world that truly practice true healthcare for our patients, right? Based on that art, that science, and that philosophy. So let's talk about what chiropractic actually is, right? So chiropractic or chiropractors recognize this innate intelligence. So the healing happens or comes from that innate intelligence. So that innate intelligence, as we talked about, is organized in the brain, through the brain. The brain distributes and sends those electrical, neurological messages down the spinal cord, out the 31 pairs of spinal nerves to every part of the body, every cell, every tissue, every organ. Tells the body what to do, when to do it, and how to do it. And those body parts and those receptors carry out the command and send the message back through that same system back to the brain. And it's a communication pathway. It's a communication pathway. When we have good communication with each other, are relationships good?
Mm-hmm. Yes.
When we have bad or poor communication with each other, are relationships not so good?
Yes.
Yeah.
True, yes.
So the key is to keep that communication pathway free. So I want you to think of the spine this way. The vertebrae are simply protective mechanism. It's the only system of the body that's entirely encased in bone.
Mm-hmm.
It's like a vault, right? The vital, right? These things in here are called vital organs. They're called vital organs. That must be important, right?
Yeah.
But are they entirely encased in bone? No. Actually, they're pretty accessible, right? What's the only thing the only system that's entirely encased in bone? It's called the nerve system, the brain and the spinal cord. The most important system of the body, the master system of the body. That's what we work with. Chiropractors work with restoring the function and structure of the master system of the body. I'm proud to do that. Here's how it works. The spine itself is just a protective mechanism. It's just a protective entity. It protects what's inside, which is the nerve system. But the nerve system itself is, again, only a physical entity. The nerve system is the transport mechanism. Think of it as the garden hose of life, right? Garden hose in the back, the water is the life force, right? You're trying to feed the body, which are the flowers. You're spraying the water, the flowers get enough water, the garden hose is relaxed, the flowers survive and they thrive, right? Somebody, as a joke, sneaks up behind you and crimps that garden hose and puts a misalignment in that garden hose, puts pressure on the garden hose of life. What happens to the water? Gets impeded, right? Can the flowers survive with a little trickle of water?
No.
They can survive, but do they thrive?
No.
No. Same thing happens with us. There's a lot of people who are just surviving, right? But how many of us are thriving, right? So think of the nerve system as the garden hose of life, right? If there's any pressure, any misalignment, any tension in any part, it interferes with those messages of function going back and forth, right? So here's where we come in. Remember, the healing happens from that life force, not the actual spine or the nerve system. It's what flows through it. In fact, our body parts are no more valuable. Our heart, many people consider the heart the most important part of the body, right? We hear about it. It's no more valuable than a pound of chopped meat in the supermarket. It's a muscle, just like any other muscle, like the hamburger, the muscle that made the hamburger that we consume. It's no more valuable than a pound of chopped meat until it's animated by this life force. When that life force flows through the nerve system and animates our physical body, that's where we become valuable. That's where healing comes from. So healing and healing doesn't come from the heart or the liver or the lungs or the physical entity. Because without that life, what happens? It rots and goes away, right? Like the cadaver. The life force is what animates our body. The life force is always perfect. So here's how it happens. Then if the spine is in a good position, an ideal position, as best as we understand through the science right now, and we do have an ideal spinal normal model. So from the side, the spine should be curved. From the front, the spine should be as straight as possible. When the spine is in an ideal position, the nerve system is relaxed and it allows the body to function at its optimal. But due to physical, chemical, mental, and emotional stresses, which we'll talk about another time, due to different stresses, physical, chemical, mental, and emotional, it puts pressure on the spine. And we can lose these ideal positions. And if that ideal position is lost, it's called a misalignment. And if misalignments are present, does that look good?
No.
When misalignments are present, it does what to the garden hose of life? It interferes with it. And that perfect life force is still perfect. It just can't get to the body parts in full force. So it's still there, we're still alive, but we may not thrive, right? And that's when we have body breakdown. And that's when people have conditions and symptoms and diseases and all those type of things that we label, right? So the idea is if we only treat the symptoms, we're missing the root cause of life and health and function, right? So chiropractor's job is simple, right? A corrective chiropractic's job is simple. We find the areas of misalignment that are putting pressure on the nerve system. We gently apply adjustive forces to the spine. And we help the body naturally restore its ideal position over time. Once again, restoring that natural innate intelligence, that flow of life and animation and function to the body. And the body can remit anything that it causes if given the right opportunity, right? The difference between healthcare and sick care is that sick care is focusing on what's wrong with you. We don't do that. Healthcare focuses on supporting what is right in you. Chiropractors are true healthcare providers. We focus on what is right with you. There's a lot more that's right within you than that is wrong with you. So we choose not to focus on what is wrong with you. We want to focus on what is right within you and help support that and strengthen that and bolster that, because we know that the true healing doesn't come from the doctor. I'm a facilitator. I'm a servant. I'm a facilitator of the healing, but I don't physically, literally do the healing. No doctor does the healing. The healing happens from within you, and you are the best doctor, and that's the truth. We help facilitate that. So that's the difference between sick care and healthcare. So I can talk for hours on these topics, but I want to keep my promise and keep it short, because I want you to come back over and over again to hear these different topics, and hopefully inspire and educate, and for us to just be together and kind of fellowship and be in each other's company in a different way than we are when we're busy and you're coming in for your adjustment and you got to go back to work and so on and so forth, right? This is a nice change. So, in closing, we're going to be doing these 2 times a month. I'd love for you to come back as often as you want, right? They're complimentary, and we're here for you. This is for you. This is my time that I give for you. So I hope to see you as often as you'd like to come, okay? We're gonna have different topics, but I need your help. In closing, I need your help. You now possess the knowledge that we've shared with you tonight. But there's thousands of people right in our community right now who are suffering needlessly from sickness and illness and diseases and conditions and physical, chemical, mental, and emotional circumstances, right? Who could be living a better life, right? We can help many of those people in some way, but I can't reach them all alone. So I ask you for your help. Tell people about what we do. That's why these are here. You don't have to put anybody down here. But if something I said tonight inspires you or touches you in some way, then simply let us know who they are, and the only thing we're gonna do is the best thing. We're gonna contact them and invite them to come to one of these, just like you're doing. And that's what that's for, okay? So we wanna have a little fun. We wanna try to help people. Help us help other people, right? Bring people with you next time. Refer them to our office. Tell them about your experience. And people want to know that human side, right? They want to know about your experience. They don't care about what we know until they know how much we care, right? Mm-hmm. So that's why we do this, right? So, so everyone here, well, not everyone, but if there's anyone here who's not an active member of our office, if you'd like to understand the health of your spine, you can see Candace on the way out. And if you make an appointment today for a spinal checkup, then we'll do a complimentary exam. No obligation, no pressure, but we'll do the exam at my expense, $75 value, okay? And the same goes for anyone who you refer to our office through this mode of way of doing things. We'll give them that same benefit. We'll do a complimentary exam at my expense, $75 value, okay? The only thing I ask is that anyone who you did share with us, please call them and let them know that you told us about them. We wanted to, because we're gonna wait 1 or 2 days, and then we'll call them. Candace will call and tell them that you gave us their info, and then we'll simply invite them in, just like you did, right? But tell them first, so that it's not a cold call, it's a warm call, right? If you'll do that, that's the only thing we ask, okay? So I thank you for your attention. You guys were great. Please come again, bring people with you, and I wish you the best, and I'm always gonna give you 100% of myself in your care, okay? So I thank you for coming. I appreciate your attention. Have a great evening. If anybody has any questions, I'll hang out. If not, get out of here, go have some dinner, and I'll see you next time, okay? Thank you very much.
Thank you.
Yes.
Have a great day, John.